Paddy is IIT Kharagpur alum, 25 years in industry. He's a veteran in healthcare, author of 2 best-selling books. He also serves as columnist at CIO Online. Along with being amazing at business and having a clear direction and for digital transformation, he's also a singer, songwriter, plays classic rock. I'm amazed at so many things that you do, Paddy. So very warm welcome to you. I think we're still waiting for polls to go away, or Vidit, are we?
Yeah, just give it another few seconds.
Awesome. Oh, I went pretty fast. I could probably introduce Paddy more. So, yeah, so Paddy has done a lot of work in industry for digital transformation in healthcare, right? And it's need of the hour that you heard from Mukesh Bansal as well. So that's pretty much where the industry is heading, health tech and otherwise, in any other industry vertical as well.
Go for it.
Awesome. So I think, Paddy, do we have you here?
Yeah,
Awesome.
I can see everyone. I hope everyone can see and hear me.
Yes.
Thank you very much, and greetings from Chicago. And it's very nice to get together with a fellow IIT alum. And I want to start by thanking the Bay Area chapter for putting together this event. So they say that let me share my screen first and then, all right. So they say that from every crisis, an opportunity arises. In this this brief talk, I'm going to talk about the perspective of what hospitals and health systems are doing in particular, not just to respond to the pandemic, but to position themselves for the future, looking beyond COVID-19. And what does the opportunity landscape look like for technology firms and startups that want to be a part of that journey? So I'll share a little bit of that. A little bit of myself, I've been in healthcare tech for over 20 years. I started my firm, Demo Consulting, in 2014. I've worked with a number of health systems and tech firms over the years. My last corporate job was with Accenture. And then I was in a couple of Bay Area analytics startups that went through successful exits. You can see my 2 books there. Nidhi already mentioned those. My recent book is the Healthcare Digital Transformation, How Consumerism, Technology, and Pandemic Are Impacting the Future. A little bit of a backstory on that. We actually had my co-author and I, we had submitted the manuscript to our publisher in February of this year. And then the pandemic hit. And we said, hold off on releasing the book because we want to see what the pandemic is doing to the themes we are discussing in the book. And it ended up that we rewrote several chapters in the book. After about a quarter or so, we interviewed more people and we were continuing to work in the space. So we were seeing a lot of things. And so we, introduced a new chapter in the book and everything. And finally it was released in August. So you can find it anywhere online. You can find it on my website as well. So just a little bit of me. One other thing I want to mention is that I do host a podcast where I talk to a lot of chief digital officers, chief innovation officers, and CIOs in healthcare. So if you want to really get a sense of what people are focusing on, I invite you to go and listen to some of those episodes. I think they're very, very educational and informative. Nidhi already let the cat out of the bag with this one. A bit of a personal anecdote. I've been a performing musician for a very long time. And those of you who are from IIT KGP in the mid 80s, or if you went to IIM Calcutta in the late 80s, you would know that part of my persona. And what I decided to do during the pandemic was I thought that I would go out on my driveway and do a bunch of concerts for my neighbors just to improve the emotional health of the community. Everyone was really struggling with the shelter-in-place and lockdown and everything. And so, every other Saturday I would go out, I'd play for a couple of hours, the neighbors would get around, sit on my lawn, sit across the street, and you can see some of the pictures there. And it really made a big difference to the emotional health of the community. And, I had a lot of people reaching out to me after that. Anyway, I ended the concerts in early September. I might be doing some Zoom concerts in the holiday season. But that was a little bit of my personal contribution to help the community deal with the crisis. So COVID-19 has accelerated digital transformation. I think Mukesh talked about it as well. There's no question about it. COVID-19 has compelled healthcare providers to think differently in the United States about how care is being delivered. The shift towards virtual care is real, and health systems are investing in roadmaps, digital roadmaps to plan for the inevitable digital future. Specifically now, technology decisions are no longer happening in a fragmented and siloed way, which is kind of how things work in healthcare. But now it's all looking at enterprise impact for any kind of technology decision. There's also a significant amount of focus in transforming core IT infrastructure. People talk about technical debt a lot, and those of you who are in information technology will know what that means. And now people are, health systems and hospitals are looking to transform their infrastructure as a strategic enabler for digital health. So this chart is from actually a live engagement that we did with one of the hospitals in New York City. We ran a survey of about 150 senior executives across functions. It's a big multi-billion-dollar health system. And so the survey responses are quite representative of what the priorities are for healthcare today. And number one priority, of course, is real-time virtual consults because people are not coming into the hospitals. And we're talking about the early days of the pandemic. And even today, people are not back to the pre-pandemic levels of foot traffic in the hospitals. It's going to remain that way. And so the number one priority is to be able to take care of patients through virtual consult models. So that is number one. But related to this is the whole notion of how to provide access to care through online tools and the ability to provide patients with, for instance, online appointment scheduling that allows them to find a provider of their choice, pay the money and get an appointment and have a consultation. These are very, very high priorities today. But there's also other things that are gaining importance. One of them is remote patient monitoring. And this has gone up in importance in the wake of the pandemic with significant potential for advanced technologies like AI, ML, and IoT, and so on. In fact, the importance of remote monitoring, even within a hospital environment, has gone up as a measure of providing safety for healthcare workers. I'll talk about that in a minute. Very interesting things. So based on the work that we've done, I want to share just a handful of examples to give you a sense of what are some of the high priority initiatives and how advanced analytics and emerging technologies are driving solutions in a COVID-19 era. Our work, my firm's work with health systems is focused on implementing strategic digital roadmaps with the right technology choices and the right vendor choices. A lot of it is focused on digital front doors, which is a commonly used term today that refers to digital engagement opportunities in a patient journey. But I want to highlight some specific examples where the use of emerging tech has made an immediate impact. The first one you see over there is actually from New York City, H&H, Hospitals and Health. It's a big health system in New York. They ran this program where they took these pulse oximeters, which basically measures blood oxygen saturation levels. They attached a sensor to it that throws off the data that was gathered at the back end in a server, and the data scientists wrote a machine learning algorithm which could then predict a deterioration for COVID-19 patients and intervene. So it served two purposes, actually. Number one, it enabled nurses to track more patients by looking at remote monitoring data and then intervene only when appropriate or only when necessary. Secondly, it also improved safety because nurses didn't have to then go out every now and then to go check on the patients physically. They could do it remotely. So it served two purposes. That was a great example. We can see that there's a lot of increasing use of chatbots and symptom triaging, especially now that everyone is trying to access care through online means. That is one big area that is emerging during the pandemic. You see at the bottom there, contactless and low contact experience. This one is very, is ironic. Who would have thought a few months ago that coming in contact with your doctor was going to be a high risk thing? But yet, here we are. Even meeting your doctor can be considered very high risk. And so there's an effort being made to reduce the amount of physical contact, except when it's absolutely required for a doctor to meet with a patient for an examination or for any procedure. And so a lot of technologies, everything from biometric identification to remote online self-service tools, they're becoming very, very popular. And there's a lot of intelligent automation related to patient communications and contact tracing. One interesting thing that's come out is syndromic surveillance. So There are algorithms that have been developed that can look at patient, medical notes and then identify whether someone is at risk of infection, and the triggers that set off an intervention so that they can kick off either a direct outreach or a contact tracing program. There's a lot of other things related to that are going on. This is just a handful of examples, but there's also more, the creative use of emerging technologies such as AI, ML that I've talked about, but also things like voice recognition, and which I think is going to be huge going forward in healthcare. Big companies are getting into it too. Microsoft, Amazon, you've seen Microsoft partner with Nuance to do a lot of things related to scribing and documentation in EHR systems. And Amazon that just came out with its Halo wearable. One of the interesting features of that is voice recognition to find out whether someone has a mental health issue just by looking at markers in the tone of voice and the words and intonation. And so interesting things that are coming up, and it's all going to come together in some way, in a holistic way. And that's what health systems are looking at. Some of you in this audience may be running startups or maybe working in technology firms, and you're trying to understand how do you really approach health systems and how do you really become a part of this journey. So I want to share a couple of frameworks that my firm uses. This one is a maturity model framework. And if you're a tech firm or a startup looking to develop a market strategy, you can use this framework to understand the maturity levels of specific health systems and decide which one you want to target. This is a 4-stage model, progressively goes from 1 to 2 and 3 and 4, building from number 1, which is really starting with the EHR system, and number 4, which is a very comprehensive enterprise level transformation strategy that looks at IT transformation, key strategic partnerships besides the EHR, and of course, selectively harnessing innovation from the technology ecosystem. This one is another one that we use. If you're a tech firm, you want to really understand your competitive position in the market. I'll just explain this very briefly. Custodians are typically EHR vendors. Everybody has to work with them because they have the data and the workflow. And these are long-term relationships that hospitals have. Enablers, which is the largest category today of technology providers, that includes big tech firms like Salesforce Health Cloud, Microsoft Health Cloud, but also a lot of emerging technology companies that are building platforms on which you can actually customize and develop solutions. Innovators are typically startups and digital health companies that focus on one problem and have a way of solving for the problem which is unique and differentiated and best in class, or maybe they're finding a solution to a previously unsolved problem. So there's this whole ecosystem, and a lot of them are actually in the Bay Area. And the arbitrages are really the global consulting firms that help pull it all together and often use offshore resources with labor arbitrage. This is an interconnected ecosystem. Everybody works with everybody in the context of healthcare. And my book, we go into these frameworks in great detail. So if you're interested in learning more, you can always get a copy or reach out to me. I'm happy to share that with you. With that, I'm going to end this and turn this back over to Nidhi in case you have any questions. I know I blew through a bunch of things here, but hopefully that provided you with some insights into what hospitals are doing and how they're positioning for the future.
Thank you. This is very good details. And I know there's a lot of information, and we will have the slides available for the later as well. But now switching to question, I'll start with one very interesting question from our audience. What does the name of your company, Damo, mean? And I think it's a good starting point. And does your company also build products in addition to consulting? I mean, how?
Yeah. The word DEMO is actually an acronym for Digital Analytics, Mobile, and Outsourcing. So when I started the company, those were the themes that we wanted to play in. And those themes have pretty much stayed in place with focus having progressively shifted towards the digital side of things. And the rest are actually sort of subtexts, if you will, for the overall concept of digital. So that's what DEMO stands for. I figured, look, if you can build valuable businesses with names like Yahoo and Google, DEMO isn't too bad a choice.
So from product point of view, it is basically services, is that right?
That is correct. So it's important for me to also explain what we are not. And we are not a product company. We are not a technology implementation company. And that allows us to provide very agnostic advice to our clients, both on the technology provider side as well as to health systems. And so we work, most of our work is with C-suite executives and health systems, and they are looking for agnostic, unbiased advice, which is not driven by downstream interests. So the advice we provide is not in any way influenced by what their ultimate decisions mean for us. We're just trying to help them make the right decisions. So whether they choose technology partner A or technology partner B, it doesn't really matter to us. We focus on giving them agnostic and unbiased advice. So that is really how we've built out our value proposition here.
Makes sense. So Paddy, now there's a question from our panelist, Ishita Sharan. She is actually our vice president of IT Varia organization. It's a brilliant question. So what are your thoughts on selling AI ML solution to payers, for example, health insurance, versus selling to hospitals? What are the different strategies and incentives one offer?
So payers have been early adopters of AI and ML, especially in their administrative functions. Now, the fundamental difference here is that, when you look at solutions for AI and ML, you really have to look carefully at the functions that you're trying to improve with AI ML solutions. So broadly speaking, if you were to look at any healthcare enterprise, you have the clinical function and you have the administrative function. That's the broad dichotomy that I would make. So when you're looking at administrative function, especially when you look at payers, they have been pioneers in the adoption of AI, NLP, ML, and so on in a variety of administrative functions. And I can pick one example, claim processing. In claim processing, they're using all the advanced analytics tools imaginable. They're looking at RPA, they've looked at AI ML algorithms for risk coding and adjustment. They're looking at fraud, claim processing. There's a whole variety of use cases that payers have been already invested in. So you'll have to figure out how your value proposition kind of is incremental to what they've already invested in. And again, that's a longer conversation, but they are early adopters and pioneers. In health systems, the focus so far has been mostly around improving clinical outcomes because they're trying to improve the health and wellness and well-being of their patient population. They're trying to keep patients out of the hospital because there are financial penalties associated with readmissions and things like that. So the focus has been mostly on population health management when it comes to AI and ML, and it's increasingly turning towards administrative functions. And now in the era of digital, it is turning towards helping patients gain access to care and do a lot of their own self-help for managing their health and wellness. So those are some areas that I would point out.
Makes sense. So from the product point of view, how they are implementing. From your perspective, from selling point of view, is it pretty different? Is it easier to sell to health insurance versus hospitals, or how do you see where is more inclination from selling point of view?
Yeah, that's a great question. There is opportunity in both, and it depends on what you're trying to sell and to whom you're trying to sell to. Like I said, payers are already well ahead in their AI ML journeys, especially as it relates to administrative functions. And it's a consolidated industry compared to hospitals. You may have, maybe when you look at the payer segment, you have 30, 40, 50 big, meaningful players. Mm-hmm. The health system ecosystem is far more fragmented. You're looking at about 5,500 hospitals, and maybe your target market is maybe about 500 of them. So it's an order of magnitude. And just to give you a sense, if you looked at the top 10 payers in terms of their revenues, number 10 on the list will be bigger than the biggest health system, biggest provider. So it gives you a sense of the order of magnitude as well. So the opportunity, if you had a solution that makes a difference for payers, the opportunity is big from a per transaction or per client, per account standpoint. But the opportunities are much broader if you're looking at providers. You can work with a much broader set of customers. So easy or not is not an easy question to answer. It depends on where you want to focus. But I will tell you one thing about healthcare, they're slow. So be ready for long sales cycles and avoid getting caught up in pilot purgatory is what I would say. This because especially with providers, there's all these innovation groups, you'll do a bunch of pilots, But unless you have a pathway to get to enterprise adoption, you will struggle.
Great. So Paddy, I have a lot of questions, but in sense of time, I'll ask one important question. So you mentioned that COVID has, of course, accelerated the digital transformation. You said 5 years and 5 months. Now, moving forward in post-COVID world, do you expect the same pace, or how do you see it differently, the roadmap of digital healthcare?
It is just accelerating by the day. I'll give you some staggering statistics. People went from 0 to 300,000 visits, telehealth visits in 3 months flat. And I was talking to someone yesterday. They had just come out of a 2-year telehealth strategy, and they had to execute it in 2 weeks when the pandemic struck. And so what has happened now is that they've put this initial crunch behind them. They're now looking at how do they take this platform and transform themselves for the future, because this is the opportunity that that this black swan event has created. I see an acceleration in certain areas. I see an acceleration in access-related solutions. So anything that improves access, anything that improves the ability of patients to quickly get answers to their immediate questions, schedule an appointment, and come in for a visit. So those are going to be huge. What might remain a little depressed from a demand standpoint, solutions that require patients to come into hospital for an elective procedure, as an example. So if you have a hip replacement that can wait till next year, it is going to wait till next year, right? So some things are going to accelerate, other things may go along in a little bit more in a slower fashion.
Awesome. There is a question in Q&A, and Paddy, if you can answer that in a shorter time. The question is, if something could be done in 2 to 4 weeks, why was it taking 2 years in the first place?
Great question. That's, I think, what people ask themselves, right? I talk to health systems executives, and what were the challenges you had to face? Healthcare is very conservative for a variety of reasons. The patient safety is first and foremost, and so they don't want to compromise on that. There's also resistance to change, et cetera, et cetera. But when you're faced with a black swan event that suddenly brings foot traffic to a complete stop, and it becomes a question of survival, you'd be surprised how much human ingenuity can accomplish in that kind of a situation. And it holds true at a personal level for every one of us, right? Just imagine if one of you were to, one of us were to lose a job, as I have in the past. Nothing like that to focus your mind on getting to the next job in the quickest possible time. Whereas if you were already in a job, why would you change? Why do you, there's an inertia of rest. You're not going to change. You're not going to look for a job. You'll wait for things to come along. Oh, but boy, when you lose the job, nothing like something like that to focus your mind. I think that's exactly what has happened to healthcare.
Awesome. So, Paddy, thank you so much for sharing the insights. It's really great. I really appreciate you sharing your ideas and time with us.